This is Chip Maxwell, and you're listening to the Retire Smart podcast with David Brooks. We welcome financial advisor Blake Grimm for a timely conversation with David Brooks on Medicare. From open enrollment dates to the hidden costs of Advantage plans and rising Part B premiums, this episode helps retirees understand their options and avoid costly mistakes.
Joining me in the studio once again is our resident authority on all things Medicare, financial advisor extraordinaire, certified financial planner, Blake Grimm. Blake, thanks for stopping in the studio.
Yeah, thank you, David. Thank you very much.
Before we jump in here, I know you look a little jet lagged. You just got back from a nice trip to Germany with your twin brother.
Yes.
So tell us a little about the trip. How was it?
It was awesome. It was 10 days, always next to my twin brother, which was good and bad. We were at each other's throats certainly some of the times when you're around someone that much, but we had a really, really good time.
So I'm going to take a wild guess that you may have partaken within a few steins of brew.
Yes, we did. We did. The German beer certainly very, very good over there. When we first got over to Munich, we went to a beer garden, and then they asked, "You want a big beer?" Yes.
Yeah, first thing, yes, we'll take a big beer. Well, listen, that's the amazing part about beer is it comes in so many flavors. I don't drink as much beer as I once did when I was younger because, well, it kind of sits on me a little bit, and so beer has a lot of calories. But what's unique when you go to Europe, it's very different than even just some of our craft brews here. But there's a plethora of flavors you can get. You know, dark beers, bitter beers, strong beers, pilsners, etc. Well, when it comes to picking the healthcare that you're going to have in retirement, a la Medicare, you have about as many choices, right?
Yeah, that's a good point. Yeah, you do have a couple of different options for what you're supposed to have with Medicare Part A, B, and then supplement or versus Advantage plan certainly is those different flavors right there.
So we've got a class coming up here, and we'll give the information on this coming up. I believe it's next Tuesday night. So if you're 64 years old or older, you probably want to come to this class if you've never attended, where Blake will go through what we kind of call the ABCs of Medicare, explaining all the different parts. But first thing I want to make sure people remember is if you're already over 65, we have an annual enrollment period called the open enrollment period. That's coming up pretty quick, right?
Yes, so that will be next month. That starts October 15th, and then that goes through December 7th is that open enrollment period.
So that's the only time of year, if nothing has changed and you're on Advantage plans, if you have a drug card, that's the only chance you have really to swap out your plan.
Yes, that's the main time, unless there's any exceptions with your life changes, anything like that. But yes, you do have a chance to switch plans.
Okay, and if you made a decision during that 6-week open enrollment period, is there any way to change it if you change your mind? Like at Christmas, I think I chose the wrong plan. Is there a redo like right after New Year, or do they get an opportunity to come back?
So there's a general enrollment period starting in January. I believe it goes through March.
So basically in January, if they made a mistake, they could still, basically re-up the plan or swap the plan if they made a mistake. The key point is do your homework, right? Do your due diligence before you make the choice. And I think what's really unique, and I think you do a great job of this in the class you teach, is that you explain that this is very different from the healthcare most of us have gotten through workplace plans where the whole family's on one plan. Well, if you're married, one spouse's plan can be very different, or you choose a totally different carrier for very different reasons, right? It's very individualized when it comes to seniors. Yes, it is very individual,
specific, based on your needs is what you want to basically choose for you.
You guys can help them understand, as I like to call it, you can pay now or you can pay later. It's an old Fram Auto Parts reference I make to an old commercial for people older than me, Chip. Anyway, but, you can choose to buy these Advantage plans or not buy them, as some people think, because they think they're free. Can you talk about how the Advantage plans, which are the ones typically that are heavily advertised on TV during this open enrollment period, are not really free?
Yeah, so there's no premiums on that. That's where they make you think that it is completely free, but you might have higher out-of-pocket costs once you actually need some coverage for Medicare or medical event. That's when it can potentially damage your
So they'll have co-pays for certain services, higher out-of-pockets than a max, I'm assuming, out-of-pocket.
Yep.
But if you go out of their network, that out-of-pocket number typically goes much higher.
Increases a lot, yes.
So there's a lot of things you want to make sure you understand. There's nothing wrong with either choice. You just want to make sure you're making an educated decision on that. And then you need to understand how to pair that with that Part D program, which is the prescription drug coverage. The reality is, as we get older, most people are going to end up getting more and more chronic prescriptions where they're taking a couple of medications every month. Statins are given out like candy today, blood pressure medications, etc. So how do they make the choice for that formulary choice? Again, they don't need the same carrier that would be necessary their supplemental coverage. It could be a totally different carrier for their drug card.
Yes, it can. Yeah, you'll have your own individual drug plan for Part D, and even if you don't think you should sign up, as if you don't have any prescriptions, anything like that, it is likely a good idea to sign up so you don't have any penalties down the road.
Yeah, because there's a penalty that actually gets pretty severe. It accumulates, right? And I believe in Nebraska, and I don't know I haven't seen the pricing for 2026. I know you probably have already gotten your eyes on that, but last year we had a newcomer, I believe it was Allstate, came to the marketplace, and they had a 50-cent drug card here in Nebraska, if I remember correctly. So again, even if you don't take drugs, you can buy the lowest cost card and then swap that when you do for one that might be appropriate, right?
Exactly.
So what other stuff will you cover during this class?
Yeah, so we will talk about how your income can potentially impact your Medicare premiums for Part B and Part D, which is the drug plan. So that's something that not a lot of people do understand, and how that works and how that can potentially harm them with their monthly premiums.
And a lot of folks that are comfortably in retirement, that are married couples, when we lose a spouse, that really hits them hard because their surviving spouse's income usually pushes them over that threshold, and then they end up paying it starts at about an $80 a month penalty, basically, and I think it's even more in 2026. So speaking of penalties, we got word, now it's not the official number, we'll have that here in a couple of weeks, but the premium for Medicare Part B, which again, people think it's free, that went up just 3 years ago. It was $136 a month. It's $185 a month now. That's jumping again pretty big, right?
Yeah. So according to the 2025 Medicare Trustees Annual Report that was released in June, they were expecting that to go up to $206.50. Now, like David said, that's not official, but that is likely what that's going to go to.
$21.50 a person if you're a married couple. So that's $42 a month. That's $500 a year. There to senior citizens that are living on fixed incomes that are being pushed to pay more. And again, this is what we call the hidden taxes, that they claw money back out of you. Well, so just you want to buyer beware, make sure you understand what these things cost, how it's going to affect your tax bill, and how to make the right decision for both you and a spouse if you're married. So some great information. When is this class coming?
This class is Tuesday, September 9th at 6:30 p.m. in the Midwest Learning Center. That is on our floor here on floor 4 at 6:30, September 9th.
So if you would like to come to that, go to their website, retiresmartnow.com, click on the events tab and register for the event, or you can just call the office, 402-369-7777. Blake, we are out of time. Thanks for dropping in the studio.
Thank you, David.
I look forward to hearing more about the how much you actually spent on the beer in Germany and our next get-together.
I don't think I want to know that.
All right.
Thank you for listening to the Retire Smart podcast with David Brooks. If you want to learn how to generate lifetime income, reduce your tax bill, and maintain your lifestyle in retirement, visit retiresmartpodcast.com. And make sure to subscribe to keep up with new episodes every week.